right now in AISD, 83,000 students will eventually be screened for spine disorders like scoliosis. That is the musculoskeletal disorder where there is a sideways curvature to the spine, I should say. And for those affected, it can make for a very difficult life. And treating it before is very involved. It was muscle stripping to get to the spine, and it was very risky and painful. But now we're happy to say there's a new, less invasive treatment that is available. And joining me to talk about it is Seton spine surgeon Dr. Matthew Geck and one of his patients, Stephanie Griffin. So we appreciate both of you joining us. It's very exciting to hear that there is something minimally invasive, because a lot of people want to get back to work, want to get back to school, I'm sure. So before we talk to you and he tells us about your specific case, tell me about the procedure. What has changed? How painful was it before, and what are you doing now?
Sure. So, in the past, just to kind of show you, if someone had a scoliosis with their the rib cage rotation they can get, we used to have to make a long incision and actually strip the muscles off the spine all the way to work on the spine. Now, with these new technologies that we're using, we can make 3 little incisions. And that's nice to have 3 small incisions, but even better, none of the muscle gets stripped off.
Right.
So we can do the whole operation without stripping this muscle and still get a great correction and kind of restore the normal function of the back for someone's lifetime.
And while you're talking about this, let's go ahead and show you a video from that procedure. Is this the procedure from you when you were being operated?
This isn't Stephanie's. This is...
and if we can show that, you can tell us a little more.
This is from Friday at Dell Children's Hospital. And if you look at the bottom of the screen, this is the curve, this is a scoliosis. But if you look at this, the screen of the procedure, you see those tubes coming out of the spine. So those are the special instruments that allow us to work through these very small incisions and to get the correction, get the fixation. So there you see, through these tubes and these very small incisions, we're performing the whole operation without having to do that big incision.
And Stephanie, I want to get your opinion on this, because a lot of times the procedure, the recovery rate took so much longer for you. You're a high stepper, and you didn't like the brace, first of all, right?
No, ma'am, I didn't like it at all, actually. But I tried it out, and it's just something I was uncomfortable with, so I didn't do it. But I proceeded with the surgery, so.
How long did you know you had scoliosis that you had to, until you were able to get this procedure?
I was diagnosed in 2008, August, so I've had it for 3 years, 4 years now.
And so knowing that you had this, you were going to go into this procedure, tell us, what it was like and how happy you were to get back to high stepping so fast.
Well, I was really excited, about the procedure's recovery time. It was really exciting seeing it was really shorter than the open heart spine surgery. So the minimally invasive was something I went with, and it really made me happy going to be able, 4 days after I was dancing in the hospital. I just felt great.
That's fantastic. Don't you love hearing that from patients? What were you hearing before with the older procedures? Was it 4 days later they were dancing? No.
I think that it was just a much slower recovery in the early stages with the older procedure, and then also a longer term recovery. But just like Stephanie, the young girl that we fixed on Friday at Dell Children's, was running around Dell Children's got beautiful gardens outside. She was running around the outside gardens on the 4th day right before she left.
Okay, we're out of time. I wish we can talk more, but you are having a screening coming up. Seton is having that screening, and I just want to thank you, Dr. Matthew Geck and Stephanie Griffin, for joining us. And it is the Seton Spine and Scoliosis Center, and that's where they're having screenings. For more health news, just head to our website, myfoxaustin.com, and click on the Health tab.